Let's talk about housing in Niagara. In Niagara region, about 10% of our population, roughly 40,000 people, require either financial assistance to afford a place to live or services to live independently. Some are in crisis with immediate and desperate needs. Others just need a safe and affordable place to live. There's a range of housing options available in Niagara, tailored to meet the needs of specific groups of people. Emergency shelters provide a temporary bed for people in crisis with no other place to live. There's about 250 beds in Niagara's emergency shelters, run by non-profit or faith-based groups. They typically run at or near capacity, especially during the summer. In 2015, over 1,600 families and individuals, including about 250 children, required emergency shelter. Niagara region contributes funding to 8 of these shelters. Others receive funding from the province. Transitional housing is longer-term temporary housing, offering supports to clients who are trying to find and move into permanent housing. This type of housing also supports people in crisis, including victims of violence and those fleeing unsafe homes. Over a dozen nonprofit agencies provide transitional housing with more than 100 beds. Niagara region provides funding to 9 of these agencies. Supportive housing is permanent rental housing for people who are unable to live on their own but don't require around-the-clock medical or other care. Think of an individual with mental health or medical issues who needs ongoing support to stay housed. This type of housing is provided by both the nonprofit and private sectors, funded by resident fees and sometimes other governmental funding. Social housing refers to rental units built or funded under a range of government programs and is intended for people who can't afford the cost of market rents. Social housing providers include nonprofit organizations and cooperative housing corporations, as well as the region's own housing agency, Niagara Regional Housing, or NRH. Rent is typically geared to income. There are over 8,200 social housing units in Niagara, 2,700 of which are managed by NRH. NRH has 2 roles, acting as a landlord and providing social housing programs on behalf of the region. Other social housing providers include 65 nonprofit organizations and cooperative housing corporations that manage over 4,100 units in Niagara. The private rental market also plays a big role in providing social housing. NRH has agreements with 74 private landlords, with NRH subsidizing the rent for nearly 650 units in Niagara. Demand outstrips supply in nearly every one of these housing options. Families, singles, and seniors are all equally in need. Many of these people are living in unsuitable housing, and all are paying more than 30% of their income on housing, with many paying much more. NRH provides short-term help to about 300 low-income households on the waitlist, helping them to afford private market rent until a subsidized unit can become available. To help address the housing challenges, in 2013, Regional Council approved a 10-year housing and homelessness action plan. The region is working with community agencies, housing providers, planners, health providers, and others to increase the affordable housing supply, remove barriers to permanent housing, and help strengthen efforts to prevent homelessness for people in crisis. As we move forward, we need to ask ourselves, what is the appropriate role for the region and NRH? Can we be more strategic in terms of who we serve and how? Do nonprofits in the private sector have a larger role to play? The answers to these and other questions will help us develop long-term, cost-effective solutions to the challenges across the housing spectrum.